Hello, my name is Kristen Taylor Wall, and I am doing a policy brief presentation today on adopting a universal syphilis screening policy in provincial correctional institutions in Saskatchewan. The target audience of my pitch are the policymakers for provincial corrections in Saskatchewan. We are in a syphilis outbreak in Saskatchewan. Rates of syphilis were at a record high in 2022, and if something is not done, will continue to rise. A way to reduce the spread is to universally screen for syphilis in all people under the age of 35 entering provincial correctional facilities in Saskatchewan. Research done in many different facilities in other jurisdictions has demonstrated that this is an efficacious strategy to decrease syphilis prevalence. The incidence of syphilis in people that experience incarceration is higher than in the general population. Incarceration presents an opportunity to detect and treat syphilis in vulnerable populations who may experience barriers to accessing care in the community. Multiple studies demonstrate that when universal screening is not the strategy used for syphilis detection in correctional facilities, that many cases of syphilis go undetected and therefore untreated. Treatment for syphilis is inexpensive and can cure the disease. Untreated syphilis may have deleterious effects on the neurologic, cardiovascular, musculoskeletal, and reproductive health systems. Syphilis transmission from mother to child may result in stillbirths or serious lasting health effects. Importantly, also, is that untreated syphilis leads to more syphilis. So, why aren't we already universally screening everyone entering provincial correctional facilities in Saskatchewan for syphilis? Barriers identified include cost, resources, and the relatively recent surge in syphilis prevalence. In regards to cost, we are already testing for and treating syphilis in correctional facilities, so the infrastructure is already there. Numerous studies have found that it is not very costly to scale up syphilis screening, and universal screening programs result in cost savings over the long term due to the decrease in syphilis prevalence over time. In regards to resources, there will need to be an increase in staffing to facilitate this strategy. To address this, we could explore a partnership with the Saskatchewan Health Authority, who are a large stakeholder in the health of Saskatchewanians and are already working hard to address the syphilis outbreak in the greater Saskatchewan population. The SHA already has employees working within select provincial correctional facilities in Saskatchewan, providing syphilis testing, treatment, contact tracing, and education. Lastly, syphilis has only recently reached crisis levels in Saskatchewan. This, however, is happening in many areas within Canada, in the United States, and elsewhere. And some other jurisdictions have already implemented universal screening programs in some correctional facilities with positive results. In Alberta, universal screening was implemented in a short term correctional facility in 2018, and the program has had success in detecting and treating an increased number of cases of syphilis. Researchers have concluded that the program is feasible for other jurisdictions to implement. Saskatchewan's Provincial Correctional Service has an opportunity to take a proactive role in reducing the syphilis disease burden here in our province by implementing universal syphilis screening for everyone under the age of 35 entering into provincial correctional facilities. There is nothing to lose by enacting this policy, but the entire province has a lot to gain. Thank you.